special call for you tonight. We've had so many emails asking us to have Dr. Rouse talk about this subject concerning fibromyalgia and lupus that we definitely wanted to do this call for you tonight. There are so many great things happening as far as things that someone can do for fibromyalgia and lupus, and we do know that the pain can just be devastating. So we definitely wanted to do this call tonight, and Dr. Rouse talk a little bit about that, but also at the end tell you how you can be helped. So very, very special call tonight. But before we go to Dr. Rouse, which you, by the way, if you have not heard Dr. Rouse speak, please do so. And if you have not heard him in person or seen him in person, please do so. He is an absolutely tremendous speaker, the best speaker that I have ever heard. He takes that complicated science and turns it into something that I can truly understand and appreciate. And we are so blessed to have him as our medical advisor here at Xperia. But before we bring Dr. Rouse on, I'd like to bring on a special guest tonight just to show you and so that you can hear really what's going on in this natural world that we have here and what can be done for fibromyalgia and lupus. And our special guest is from Madison, Florida. She does not hail from Madison, Florida. She is a true Kiwi from New Zealand, and many of you know this wonderful lady. She is a leader here at Xperia, and she's had so many results with one of our products, and we'd like for her to share with you before we bring on Dr. Rouse, and her name is Ray Pike. Ray, are you with us?
I certainly am, Jack. How are you this evening?
I am great. Thank you for coming on. If you can just tell us and the listeners kind of a story about what's happening with you and kind of before the products that you were taking and now what's going on.
Okay, Jack, thanks. Jack, can I first say one thing? I'd like to say happy birthday to the United States Army. In 1775, on June 14th, the United States Army was formed. So happy birthday to any of you Army people out there.
Absolutely.
And also, it's Flag Day today, so that's an important day.
Yes.
And again, it's another important time this month. It's 2 years for me on the amazing product OPC Plus. About 7 to 10 years ago, I was diagnosed. I was a chronic case of fibromyalgia with myofascial pain. In fact, I spent several months of my life being crippled and having to live on pain medication, antidepressants, and steroid shots. And so my life was pretty miserable. Well, 2 years ago, in June, Jack and Gloria introduced me to OPC Plus, and in fact, Gloria mixed it up for me because I had a terrible, terrible headache. Headaches are one of those things that come with fibromyalgia with a lot of other various other body conditions, that happen with fibromyalgia. But anyhow, 3 months into it, I added aloe red to the mix, and I was pain-free, and it was just like a miracle. And anybody who knows me, and of course, guys, you haven't seen me for a little while because I actually am now a COI with the United States Army, and I'm actually working with a lot of our military families. So I have been diligently taking my OPC, and then there was a little stage that I decided that I would maybe try another one of the products, and I sort of was weaning myself off OPC. Well, that turned out not to be such a good thing for me with the stress and the travel arrangements that I'm doing with the Army. My pain level crept back in, and so I went back onto my regiment of, which is once a day for me. It could be different for somebody else, but once a day, my OPC and my aloe red, and within a few weeks, I was right back to being pain-free. I do a military workout now. A lot of you who haven't seen me for a while will be surprised, but I actually physically now can work out. I have a routine of working out 3 days a week, and then I do one of the military workouts once a week. So anybody who has fibromyalgia will know that that's almost an impossible thing to be doing. But 2 years on OPC Plus, I am physically capable of doing a military workout. I was in Fort Benning. I got to jump out of a 4-story building and scale down a 40-foot wall. And I am just very, very excited that at my stage now that I'm actually reliving my life without pain. So, yeah, you can tell I'm very, very excited. I can't imagine my life without OPC Plus. It is just, to me, like a tonic that I take daily and will continue for the rest of my life to take it daily. So that's my story, and anybody's welcome to contact me if they'd like to get any more details. So thanks, Jack, for giving me this opportunity, and I wish you all well out there, any of you others with fibromyalgia.
And Ray, and I'm sure you run into a lot of support groups that people have fibromyalgia and even lupus,
yes.
And the pain can be devastating.
Devastating, very, very devastating. And some of the medical regimen for treating fibromyalgia is also very devastating because they will put you on a course of antidepressants along with, at one stage they wanted me on OxyContin because I actually had become quite crippled with the condition. And so the medication that they prescribe is also very devastating for the body, and you really become almost quite a zombie. And I am 100% free of all medication that they were giving me for my fibromyalgia. I literally have my life back. I was going from up to a size 16 in clothing. I'm now a size 8 in clothing, so I have lost weight, and I have a wellness now that I haven't had for over pretty much 10 years of my life. So, yeah, I'm a very happy person. I am so grateful for Jack and Gloria introducing me to the OPC Plus.
All right, thank you so much, and we're so excited. And I really don't think I could jump from that building or scale down that building. You must be doing really, really well as far as the pain.
Well, and this year is a big year for me because I'm celebrating my big 60th birthday this year. So it's kind of exciting, and I'm actually going back to Fort Benning to train. I'm actually going to be jumping out of yes, folks, I'm going to be jumping out of an airplane with the silver wings, the United States Army parachute team. So I'm kind of excited, and if I really was suffering with fibromyalgia, Jack, there is no way in the world I could be doing what I am doing today.
That's great.
So
absolutely. Well, thank you so much.
Well, thank you for giving me the opportunity to share.
Okay, thank you.
You're welcome.
And Dr. Rouse, what an amazing story. I know that you see patients that have fibromyalgia and lupus, and that's just amazing to hear that really turn Ray's life around, no prescription drugs, which I know, as she said, those can be debilitating themselves. And it's just amazing that we have got a product like this that is this high quality and this strong that it would do that. And so can you tell us tonight what's going on with Ray?
Wow, that's a ditto all the way, Jack. And Ray Pike makes me proud to be an Army brat. My dad retired Lieutenant Colonel, U.S. Army, and he started right there at Fort Benning in Georgia. What an amazing story. I can't wait to hear her when she gets her silver wings. Mm-hmm. The truth about it is that fibromyalgia and lupus for a long time were like mysterious problems. People would go to the doctor would say, well, perhaps it's in your head. Perhaps we need to give you a antidepressant or a drug to just try to make you feel better, mentally. But the truth is that fibromyalgia is very chronic, and when they looked at the numbers of people that have been inundated with it, they found that it's way up in the high millions on fibromyalgia and in the low millions on lupus. Now, lupus itself will have a lot of the symptomatics of fibromyalgia, but lupus is actually a a medical problem with the immune system. What we find in an immune system attack is that the nucleus of the cell gets bombarded by these antibodies, and they call this test. They look at it. They call it an anti-nuclear antibody test because they're looking at the blood to see if those people's antibodies are actually trying to get down into the cell and disrupt the whole cell structure, the nucleus of the cell. And when we look at it in particular, we find that it's both spread out with a lot of multiple factors of pain. They almost always say, oh, my neck, my shoulder, my back. And then when it starts dipping into the hips and the upper and lower extremities, I've heard people say when they get up in the morning, it's like, man, I feel like I've been in a boxing match for every round. The word fibro is from the tissue that holds us together, the fibrous sinew, and the word myo is just the Greek and the Latin for muscle. And anytime you see the word algia, that's pain. So fibromyalgia, meaning the fibrous tissue that holds the muscle, including the muscle itself, is under attack, and the inflammation rate is very high. And because of that, when you touch them, when you finger point a certain area on the neck or the back, it's a hot spot, and they can just about jump out of their chair if you press them too tightly. So fibromyalgia and lupus are definitely painful muscles. And the symptoms can be very much beyond just hurting all the time. Many folks will be exceedingly sensitive to hot and cold. Even the temperature variations can create chaos. They'll complain of not sleeping well, and if your partner in the bed, if they're married, they'll usually say, man, my mate is very restless, very restless. The legs are just knocking the sheets off of the whole system. And when they do wake up, it's difficult for them to walk on their feet. They have an Achilles tendon that gets all tightened up, and the whole painful scenario can jump from here to there. And imagine if it gets into the other areas of the body, like in true lupus. That inflammation can attack the bowel structure, the kidney, the organs, the skin. All those factors begin to play, and symptoms of fibromyalgia are that these people feel lousy all the time. They just don't have a good day. So they need a lot of encouragement and a lot of support. The next slide says, well, who gets it? And would you believe that most fibromyalgia patients and lupus patients are women? The greater majority, probably as much as 90%. Now, in that one factor called lupus, out of that 90% women factor in lupus, 90% women, 80% of those women are African American. So sometimes it must have a lot to do with genetic structure. But just talking about who gets the actual fibromyalgia, it is very common in age 40 and 50, and people who have ever had a bout with arthritis earlier in their life, or even people like who have had lupus, diagnosed with lupus, where their anti-nuclear antibodies have been looked at and discovered. These people with lupus almost invariably come down with fibromyalgia, the chronic pain, the continual problem with it. And if a sister or a mother or a family member has had it, then we need to keep our eyes wide open, because there again, it just seems to have a pattern. from the family itself. Which always leads to the next question, what causes it? I mean, is it something that I get from eating on a spoon after somebody else? No. It's generally stress, traumatic stress. These people may go through horrendous marriages. They may have been in a severe accident. They may be a person who is repetitively functionalizing their body with continual injuries, or they may have come down with an illness during the wintertime, which they never just could seem to get over. And because these stimuli just keep flowing and the blood keeps trying to fight it off, the antigen doesn't like the antibody, and the antibody doesn't like the antigen, the central nervous system has a hard time. It just says, look, I am having a hard time. You are flooding the floodgates. It's like I'm on the walkie-talkie and nobody's taking a break. It's continual, incessant pain. What shall I do for you? So the causes, who knows, but they're real. And whenever they go to the doctor, if they go to the doctor and they say, Doctor, I think I have fibromyalgia. Well, there's not a diagnostic blood test, a laboratory test where we can say, well, let's do a SMAC or a complete CBC. Let's run it over to the blood lab, and they'll come back with a complete, it's not like we have a thyroid dysfunction or a kidney dysfunction or a liver dysfunction. Yet, the physiological pain is there. The problem is not in their mind. It is real. And because these tender points are all over the body, these people need help, they need sympathy, and they need some get up and go. So on the next slide, we look at the usual. I heard Ray Pike tell us that when she went to the doctor, their primary choice for treating her medical problem was an antidepressant. Or perhaps they may say, well, let's try this patient on something that's anti-inflammatory or actually pain-killing. And if you look at that abbreviation there, non-steroidal anti-inflammatory, that's very popular, isn't it? People have them in their purses and in their medicine cabinets. They're over-the-counter. Ibuprofen, Aleve, the things, the ketoprofens. But did you know that all non-steroidal anti-inflammatory drugs degenerate the cartilage tissue of the human body? So they were never made to be taken more than just 3 or 4 doses and then be off of them for a long period of time. Non-steroidal drugs, when taken on a day-to-day basis, cause you to have knee replacement, hip replacement, and they cause the joints of your body to prematurely wear out. Now, if you come into a person with lupus or fibromyalgia, sometimes you'll meet them and you haven't seen them in months. And when you see them, their face is swollen like a moon and all puffy. And that's because a lot of doctors have chosen the route of prednisone or corticosteroids or steroids to try to fight the inflammatory response of the lupus or the fibromyalgia. And when they look at the medical textbook, they should realize that these kind of drugs are not the best. Did you know that if somebody actually has lupus, the physiological autoimmune disease, that they should never be given many of these steroid-type drugs, and even things like birth control pills, which are steroid drugs? They should be very cautious. Sometimes a lot of our fibromyalgia and lupus patients don't realize this, but they may come down with a case of heartburn, indigestion, and they may take something as simple over-the-counter like Tagamet, bought over-the-counter for heartburn. Tagamet exasperates lupus and the fibromyalgia symptoms. So sometimes over-the-counter and prescription drugs are actually making them worse. And then they listen to the patient. Patient says, look, restless legs, pain and aches, no sleep. And another Lunesta patient, no. Another Ambien patient, no. That's not what that patient needs. Yes, that patient needs sufficient rest with good REM sleep, with good alpha rhythm sleep. Sure, they're helped with massage therapy to get the toxins out. Chiropractic medicine helps these patients extremely well. Trying to get them to walk a little, to do any kind of physical exercise, becomes exceedingly popular and very beneficial. But then we get down to the nutritional side of it. And the question then becomes, what nutritionals will help these people to feel better? So on the next slide, we ask some very simple statements to be answered. You need something that's going to help fight the fatigue. We need something that's going to boost your stamina and your endurance. Now, one of the best ways that I can fight your fatigue is to give you a good, restful sleep at night. The next thing we know that if I'm going to boost your stamina and your endurance, I've got to make sure that the nucleus of those cells are not being bombarded. And I also need to know that the mitochondria, the little factories in the cells, are working in your behalf. So what is it that I can do to help you to increase your exercise tolerance? You're telling me you can't walk from here to the mailbox? What would it be if I could help you to walk from here to the mailbox and back 20 times? Or do you need a little more encouragement to tell you that you need to be very cognitively aware of what you eat? These people need to eat a lot more of the citrus fruits. They could do well with the broccoli, the turnip greens, the sweet potato, the spinach, the power foods. But here's a case where we need to pull out and get away from white refined flour and white out the sugar in the diet. So sometimes balancing their diet makes a lot of sense. And now they say, but Dr. Charlie, I really would like to just have my old self back. I'd like to be the Ray Pike that I was years ago. I'd like to feel so good that I'll go to Fort Benning and jump off a building or fly in an airplane. You know what? When you get that sense of well-being back, then you know you've won the battle. So you really need something that we would call would be a nutritional powerhouse. You really need something that has a nutritional profile that's unmatched by food. There's no way that you could eat enough citrus fruits or enjoy the fruits and vegetables sufficiently enough to get the richness of the vitamins and the minerals and the amino acids and the antioxidants. Gracious, you'd be swallowing pills all day long. You'd be trying to drown yourself in liquid vitamins if we were just going to give you a nutritional supplement that could try to go in there and do the magic trick. What we need is a nutritional supplement that's different from any others. We need something that's beyond the pill, beyond a capsule, beyond even a pre-made liquid in a bottle, in a 32-ounce bottle. We need something that's going to balance the immune system. See, in lupus, the problem is autoimmune. The problem is friendly fire. The problem is their immune system is shooting with its own bullets, the nucleus of its own cells. It's an enemy attack from within. So we need something that will modulate, that will master those molecules. We need something that can go inside the cell structure, that's allowed to cross the barrier of the cell and enter into the factory called the mitochondria. We need something that's rich in polysaccharides and polyphenols, something that is very high quality, but something we also know that is standardized, meaning that it's not just another nutritional. It's something that has the real McCoy stuff in it. So as we look to it, we say, well, obviously, if we were to restore your life to a better sleep pattern, a REM sleep and alpha-beta rhythm balance, if we could literally reduce the fatigue and give you back better energy, then offsetting that depression would come naturally. We wouldn't need another Prozac or a Zoloft or a Wellbutrin. We would just need that sense of glee. And we heard a testimony that Ray Pike said that when Gloria gave her one simple scoop of the world's best nutrition and she drank it down, the headache went away. Curtailing cluster headaches is an amazing thing. So we need something that's very rich in Krebs cycle ionic magnesium. We need something that's going to help the blood to become better oxygenated and to make the ATP adenosine triphosphate, the phosphate side of the energy production, become phenomenal. We need something that's going to provide catalytic conversion so that the enzymatic therapy, the things that will move the toxins out and the good stuff in, enzymatic therapy. We need something that will complement that. We need something that will help the body to maintain the membrane so that the enemy is not allowed back in. Once we push the enemy out, we don't want them to be able to come back into the cell and try to destroy the nucleus of the cell. And all the while, we want to be able to polish up the sinew, the fiber, the tendons, the ligaments, and the muscle. We need to do it so that it will feel better. And then we come to the nutrition and we say, well, if we ground up all the stuff and put it in a capsule, probably that'd be a minimum of 36 capsules a day. Can I get you to swallow that every day? No. But if we put it in a little scooper, a little tub with a little scoop, and you scooped it out, that purple stuff called OPC+, and then you reached over there in that little red tub and you scooped it out, the polysaccharides of the aloe red. And then you reached over there in the little yellow tub and you scooped it out, the power-producing, immune system-enhancing, is life. And then you began to fill it with ice-cold water and you stirred them together. And when you drank it down, the body would say, look what's happening. My liver is getting cleansed. My cell structure is getting regulated. The pain is beginning to subside. This patient says, what can I do to restore my energy quickly? We say, here, try this. It's called a B12 sublingual tablet. Don't chew it. Don't swallow it. Dissolve it in the cheek or under your tongue. Just let it be a nice, slow, even distribution. And within 30 minutes, that particular B12 has met the awesome production of the power of the grape, the power of the glucomanna, the ace manna from aloe, the power of the fucoidin from the ocean. And when those things start enriching the cell, these people start putting the autoimmune in remission. Their energy levels come up. Their day is much better. And then the sun begins to go down. And they say, but Dr. Charlie, I'm afraid to go to sleep. I don't want that restless legs tonight. I need to dream better. I want my night to be as good as my day was. And we give them a simple scoop of serenity. The GABA goes in there with the melatonin, and it literally refurbishes the brain cells just as equally as the Is-Life and the Aloe Red and the OPC have refurbished the body muscular cells. And when the muscle is happy and the brain is relaxed, the next day could easily be a Ray Pike day. So isn't it amazing that when Nutritional is the mainstay, things that they can't even diagnose, though we know that fibromyalgia is as real can be, we know it is working when the body is being read like a book, and the book says, this is a good chapter, this is a good day, and I can't wait for the next day. It's all in nutrition.